This is Chadi Alraies from NCVH 2023. I'm very privileged today to be with Dr. John Evans to talk about a very important topic related to building a bridge of knowledge between podiatry and interventional cardiology. Dr. Evans, thanks for being with us.
Oh, it's my pleasure. Thanks for having me.
Yeah. So, Dr. Evans, we were talking offline about how important your specialty is in early recognition of PAD and CLI, and how to create pathways of referrals to get patients properly treated for CLI.
You're absolutely right. Podiatry is one of the leading areas of referral into vascular problems because we're seeing the patient's feet multiple times a year, and unfortunately, often PAD is missed by the patient or by their primary care group. And so one of the responsibilities of my profession is to be able to find out what's going on before something bad happens. Because basically once they reach a symptomatic stage, we've missed out on a lot of opportunity.
And I have to speak to that. I was trained in cardiology for 3 years, but I never thought I should be talking to podiatrists, or I would expect a referral from podiatrist for somebody with PAD. Never been trained before or talked about to, which is a gap of knowledge on our end, not on your end.
No, it works both ways, because it was probably 12 years ago that I was asked to speak to a cardiology group, and the question was, why would a podiatrist talk to us? And I have to say, I had the same impression. I didn't realize why I should be keeping an eye on the cardiovascular status of a patient. I mean, I knew what peripheral arterial disease was, but I didn't connect the dots. And yet, once I met some cardiologists or interventionists and some interventional radiologists and such, I realized that we're walking along the same path, just slightly off kilter from each other.
Yes, you're right. And I see it when you have a CLI or an ulcer in the foot, is like having a heart attack. I don't think it's far from each other.
You're right. When we look at the acute limb ischemic event as being a heart attack of the leg, which is a horrible event, because if somebody suffers an ALI, you know that the risk of them dying goes up 3 times.
Exactly.
And the risk of an amputation goes up to 200 times. So we'd much rather get to these patients before they suffer that life-changing event.
So you see a lot of people from your perspective. So what is you are doing in terms of awareness that we should be aware of to teach our patients?
Well, probably the most important thing is that we work together. If you see a patient and they've been on the table, or you've been following them up from someone else, that patient, if they have a leg, needs a podiatrist, because we can be your eyes on the ground. You may see the patient for interventions and maybe for a follow-up. We're going to see them multiple times a year. So it's a real important network. On the other hand, if someone has vascular insufficiency, I can't fix it. I need a specialist who I can work with. And so it's a perfect network back and forth, where we send the patients to you, and then afterwards we can watch the patient for you, but also provide the basic care that gives them the best opportunity of saving that limb and living a better quality of life.
Right. I think we did, from cardiologist's perspective, we created great guidelines and pathways for managing patients with STEMI. I don't think we are there yet in terms of creating a team. And I think, as you said earlier, CLI and ALI is just one person. It's podiatry, it's cardiology, it's endocrine, it's primary care, there's wound care, hyperbaric chamber, all together, put together. And I don't think we are yet, we have this kind of a teamwork put together.
We don't, but the studies have recognized the benefit of having a CLI team or a PAD team of some sort, where each of the specialties are working together. One of the problems we have is availability of the specialists in different geographic areas across the country. Because although everyone recognizes that this is an opportunity, you and I practice in Southeast Michigan. We're very fortunate. We've got great specialists all around us, but you go to some other areas, such as rural areas in the south, or even for us, Upper Michigan, there are often not specialists within 100 miles.
Correct.
So the opportunity fails, but that doesn't mean we can't make things better by working together.
Absolutely. Well, it was so a pleasure talking to you, Dr. Evans, for a very insightful take on the podiatry cardiology collaboration for patients with CLI and ALI. Watch these videos and others on the YouTube channel for NCVH. This is Chadi Alraies from New Orleans. Dr. Evans, thanks so much.
My pleasure.